Good morning. Thank you for joining me today at the Medical Device. And I'm giving a talk about medical devices, the application considerations for the use of silicone adhesives. First, we're going to go at a high-level review of what we're going to be covering today, general types of silicone adhesives, the design and process considerations for medical silicone adhesives, and then the applications and R&D trends that are being seen out in the marketplace today. In general, there's at a high level, there are two large divisions for silicone adhesives. There's the industrial side that has been around a long time, high temperature applications, high shear strength, or construction using silicone rubber attachment. I'm going to be sticking to the skin or stick to skin side of medical adhesives. Liquid silicone adhesives have been available for many years. They are chemically inert, so they're stable in use and aren't affected by outside chemicals that might be used near them. They're high oxygen transmission. They're well noted for that property, and so you get very healthy skin underneath the silicone adhesive. There's a high grade of polymers that are used against the skin, and it may stick to other silicone substrates, but we're going to be talking about the ones that are designed specifically for skin and the liner considerations that have to be used for that, and device attachment to the skin. So when we dive down a little bit farther, there are liquid two-part or one-part silicone adhesives that are brushed onto the skin and used for prosthetic devices applied by the end user, or there are catalyzed silicones that are cast in place or into sheets that are used for wound care or chemesis applications for scar reduction. Those are provided in liquid format and have to be either cast and cured into sheets for use for the end user, or they're supplied in bottles or roll-ons for use by the end user. Today I'm going to be specifically looking at the gel or matrix type silicone adhesives that are supplied in tape formats with different kinds of backings. They're converter friendly, so you can put them onto a converting piece of equipment like a Delta or any other piece of converting equipment, just like any other tape, and be used in the processing to make a surgical part or a medical part or a finished device that can be packaged and used by an end user. Human skin can be a very difficult surface to stick to. I think that's why there's only a few companies that make adhesives that stick to skin or work well on skin. But it is, I say contaminated surface, but that's natural contamination like sweat, dead skin cells, lotions and powders that people may use can cause difficulties when trying to attach to the skin. Then you have breathing sensitive surface. Nothing quite like skin to try and stick to. There's no good test surface for it. You have to actually try it on the skin because nothing else produces oils, produces sweat, grows hair underneath where you've clipped. And so you have to be careful with allergens. There's a lot of people who are allergic to some of the tackifiers that are used in adhesives, and so the inertness of the silicone can be a real plus when it comes to avoiding allergic reaction on the skin. High MVTR, that helps keep the skin healthy underneath by preventing maceration. Mechanical trauma on removal can be another point of irritation on the skin. You have to deal with the cell renewal cycle that is automatic for everyone. The entire surface turns over in 14 days. Your entire skin surface from the lower levels on up turns over every 50 days. So you have to be aware that, pushing for 2 weeks on a stick-to-skin application isn't usually a good idea. 7 days tops. It is an elastic surface, so you have to remember that when you're dealing with devices that are put over joints or over areas, the skin stretches during a movement. And so your product has to be designed to either avoid those areas of high movement or deal with them during wear. Skin's a low energy surface. It's very similar to trying to stick to untreated low-density polyethylene or polypropylene. Things don't like to stick to skin, and so you have to make sure that you select a product that's going to stick well to that low-energy surface without a lot of pre-treatment, other than soap and water. And it's also a rough surface. It may not look it when you see it, but when you're trying to stick to that surface, you're dealing with microscopic or sometimes visible wrinkles, crevices, unevenness because of hair, or just the skin itself can be rather uneven. The opportunities for silicone adhesives are with fragile skin. Fragile skin is very sensitive when you're trying to wear adhesive for a long period of time or remove that adhesive. Radiation and chemotherapy can make that skin, even on a person who's not normally sensitive to adhesives, it changes their entire body chemistry and they become more easily traumatized by adhesive removal. Age-related, both at the two ends of the lifespan. The geriatric patient has very thin, delicate skin, as does a neonate. Their skin isn't fully developed, and you can easily traumatize a small infant in a NCIU unit by taping and repeatedly removing that tape. So silicones can help with that because of the gentleness. Chronic use devices and repeat location. That's ones that have to be always put into the same space over and over again. Ostomy patients, or when you're dealing with wound care, you're repeatedly taping over that same area, and that can cause trauma. Silicones can help you benefit from repositioning or readhesion. If you're doing electrodes or sensors now with sporting sensors for heartbeat and rhythm and for temperature, you want to be able to move that electrode to the right spot in order to get the strongest signal. And silicones can help you with that. And then steady adhesion to skin. Some of the adhesives build, some of them don't build or delete over time. The silicone tends to stay the same. So short-term or medium-term applications where you want to be able to remove it without traumatizing the skin, and for cosmetic attachment. And we'll get into that a little bit later. With fragile skin adhesion, again, you're dealing with people who have chemotherapy or radiation therapy effects where the skin is actually being sensitized by those treatments. You deal with babies, neonate children who are in fragile health to begin with, and you don't want to cause any more irritation or the chance of infection. So a silicone adhesive can give you that gentleness that you need to help that child or that older person have a more positive outcome from their time. The silicones have a unique, the silicone matrix and gel adhesives have a unique structure internally. You'll find that they're mostly 4 to 6 mils thick. There's a lot of 6 mil ones. The 3M ones are 4 mils thick, but they have almost like an internal spring effect. They stretch to remove. It doesn't cause the skin to stretch to remove. So it helps reduce trauma by absorbing that energy internally to the silicone adhesive. And that's why you can get such a nice, gentle and painless removal or reattachment for the silicones. The chronic use and repeat location. Again, you're dealing with retaping in that same spot. A fresh piece of tape, you start all over again from scratch. If the first piece of tape has removed the top skin cells, then you're attaching to another layer. And the farther down and the more often you do that, you can build up and remove a lot of skin cells and cause trauma, and actually a wound can spread simply by re-traumatizing the skin over and over again. That's what's so nice about the silicone adhesives. They don't cause the irritation. They help oxygen. They transport oxygen extremely well through the skin. And it's an inert chemistry, so you don't have to deal with tackifiers or other irritants and additives that can be in some other adhesives. With maceration, the skin will wrinkle and it'll hydrate the skin cells, and that makes them more easily removed, and it can cause that white wrinkly effect when you take your bandage off. That's maceration, and that again causes the skin to be more delicate. With the oxygen transmission and the high moisture vapor transmission of the silicone adhesives, even though they're thick, they help reduce that chance of that buildup underneath the bandage. So you can get the high moisture vapor transmission and keep the skin healthy underneath. Again, the skin stripping, low trauma removal with that internal spring effect of the silicone. It absorbs that energy, and so it doesn't remove the skin cells. The two lower pictures there, on the left side, yes, the left side, that's a standard acrylic seen under the microscope after it's been removed from the skin, and you can actually, in red, see the skin cells that it's removed. Now, those might be mostly dead skin cells, and in this case, it's unhealthy skin. So it's skin cells that would normally fall off during, say, the next day or two. So it's not a big deal, but what it does is interfere with the readhesion. That's why a lot of standard adhesives, synthetic rubber and acrylics, you can't put them back down and expect that same adhesion level. With the silicone on the right, it's only removed a few of the dead skin cells. It hasn't pulled any hair, and you can put it back down in that same spot without causing any more skin stripping to occur. And it doesn't leave residue behind. That spring effect, it stretches and removes itself from the skin surface, so you don't lose the residue. You don't see a lot of cohesive failure, which is internal failure, because of that stretch to remove effect that you get from the silicone. And it has and you need a strong attachment to the backings, and we've overcome some of the difficulties at 3M with getting good attachment to backings. So it's offered on thin films and spun lace and as double coat tape. So anything that you would need for converting would be available in a standard tape format for a lot of different applications. Choosing applications that will benefit from the repositioning and readhesion benefit of silicone adhesives can be a real plus for your toolkit. Electrodes and sensors of all kinds can benefit from this, being able to lift it up and adjust it. Normally on an electrode that someone's getting fitted with in a surgical application before they go into surgery, they put on all these electrodes, and if they're not getting a strong signal, they have to take it off, start again with a fresh one, and put it back down to try and find the right signal spot. With silicones, you can just pick it up, move it over, and check your signal again. You can use the same electrode to get to the right spot, and so in the long run, it can save time and materials before an OR electrode situation. With sensors, the sporting sensors, you can put them on, take them off if you're going in for bathing, or if you're in a high sweat application, you can take them off, remove the sweat, put them back on again, because they'll readhere to the skin in the same spot. So there's some real pluses to that, plus the high moisture vapor transmission, oxygen transmission, help keep the skin healthy underneath. And that can be a real plus when you're dealing with active adults with some of the new athletic sensors that they're coming out with. Respiratory devices, both face masks or tube holders for respiratory health when you're got oxygen and you're taping underneath the nose. That's a very thin skin, very sensitive area. A lot of nerves run through there. And being able to either adjust it or remove it without causing a lot of skin stripping or pain could be a real plus for people. And so you can take that off. They can go take a shower, or you can bathe them and put that same tube holder in place again, and it'll give you a very nice outcome during an OR stay. The face mask seal can be a real plus around the nose and the neck area. Those are very thin skin, very flexible areas, and you can get a rash underneath the chin if you're using adhesive there. And on the nose, it's particularly difficult to adhere in the nose area. There's little metal clips, but a lot of people find it difficult to get a good seal with just the metal clip. Adding a strip of adhesive there, especially as silicone, because it's thick and conformable, you can get an excellent seal in this area, and it's not as affected by the oils around the nose area that you sometimes see with the other adhesive types. Steady adhesion, another plus for silicone adhesives. The graph up there is just in general over time. Acrylic adhesives tend to build. They'll start off a little low on adhesion, but they will build with time. Synthetic rubber adhesives, you have the really great quick stick, but after 3 days they tend to fall off. And silicone adhesives just have a very steady, they're a good quick stick, and they also have a nice steady adhesion at the end of the 1 to 3 days wear time, depending on the application. So it's going to stay pretty much the same, which is an excellent thing for around the eye area if you're using eye pads or eye covers. The temporary tattoos on the face, very popular item, underneath the eye. You can get a very gentle release there for children. So it can be a real plus for small children that like to wear their sporting tattoos or a temporary tattoo of some sort. The short-term applications where you're going to have it on for just a few hours, like the electrodes in the OR. They're only used during the surgery and then they're removed. And so you can help cut down on some of the traumatized skin that might be seen with those on especially older patients. And you can do a combination. If you need a longer wear time than the few days that a silicone, because it's gentle, will not give you a week's wear. But if you combine that with an outer rim of an acrylic adhesive to give you the longer wear, you can get the gentleness in the area that you need it, but you can add an overlay or a border of the acrylic to give you the time dwell, to hold it in place a little bit longer. So in general, to get this tool into your design toolkit, the things to think about would be to select the right opportunities to make it successful, utilizing the special properties that silicones provide. Remember that it's a thick, soft adhesive, and keep the design simple. Don't do a lot of complex designs because you might not be able to remove all the small parts. It has a tendency to heal itself if you don't remove the weed right away. And plan ahead for sterilization. And I'll go into that a little bit more. When you're using silicone adhesives, you have to consider the type of release liner that you're going to be using. If you're inserting another liner, or if you need a thumb tab, where you need something that has to be done special to that adhesive to make it easier for the end user to apply it. So a secondary or insertion liner, you have to make sure that you pick the right one. If you're going to just take one of your silicone adhesives or silicone release liners that you've used on all the other tapes, it could build with time, and the end user may not be able to remove that silicone release liner from a silicone adhesive. You got to remember that one of the reasons that silicone adhesives are very popular in industrial applications is that they're used for splicing tapes on silicone release liners. So look for a fluoro-silicone hybrid adhesive that includes a fluoropolymer section to that release polymer, or go with straight fluoropolymer release. Those will give you the easier end-use release over time. The silicone, the fluorosilicones will be an excellent in-process liner, but maybe a little difficult for some of the geriatric patients to remove because it is a little bit higher in general than a straight fluoropolymer. But the fluoropolymers and the fluorosilicone polymers, you shouldn't be looking at gamma sterilization. Gamma sterilization can cause those to cross-link, and then the liner won't come off. So remember that in the long run, you might want to consider only using ETO-type sterilization. The ethylene oxide gas allows for good sterilization without the cross-linking that the gamma and the E-beam can cause. It's possible that you could use steam sterilization, but we really haven't considered that, and in general, most of the applications that we're looking at probably wouldn't be steam sterilized to begin with. So ETO. Then in the top markets that we're seeing R&D right now are sensor attachments, both in the hospital and for sporting and other at-home uses of sensors. It seems to be an exploding market today with the miniaturization of electronics and the ability to make flex circuitry. Being able to hold them on the skin and being able to put them in the right spot to get the best signal on the receiver, especially for wireless, is a real plus, and silicone adhesives were almost designed for this type of application. You can pick it up, you can take it off for bathing or for getting in the hot tub, you put it back on in the same spot, or you can move it around and still get a good attachment. 5 to 10 reuses possible depending on how it's used, how it's stored, and the person that it's on. So the sensor attachment is a very good area for growth and something to look at for the converters markets. Wound care dressings. Again, silicone adhesives seem to be the way that a lot of the advanced wound care applications are going. Because silicone's inert, it's gentle, it's not going to traumatize the skin around that wound, and with the high oxygen and moisture vapor transmission, it helps keep the skin very healthy underneath. So it's all a real plus for the wound care healing. Retail, fashion, and cosmetics stick to skin. We have Corey there as our model for cosmetic applications. Sticking to skin in sensitive areas can be a real pain for removal. You want it to adhere for as long as you're going to wear it, which is 8 to 12 hours, sometimes a little less. But you want it to remove without causing somebody, they're never going to touch it again, or they're going to be traumatizing their skin just to look nice. Temporary tattoos fall into this. Cosmetic taping or fashion taping falls into this category. Appliances for theatrical appliances could benefit from using a silicone adhesive because you can hold a nice, vinyl or silicone appliance on the face for theatrical or wigs and mustaches in sensitive areas without having a horrible cleanup afterwards, and also traumatizing the skin and causing irritation or even allergic reactions. Geriatric and neonate securement, one of my favorite areas, because I think that a lot of people have grandparents that have been in the hospital or parents and know someone who's had a child in the ICU units, where you don't want to traumatize them any more than they already are. So anything that you can do to make it gentler and more comfortable for them to wear the electrodes or wear the tube holders to give them the oxygen, anything that you can do to make that easier and gentler and less traumatic is a real plus, because they're already being traumatized to some extent. And then respiratory device attachment. We're seeing more and more of that for sleep apnea type applications, or just home use masks for protection, just in case. You can keep them in your drawer, and if you need them to get out of a building, if there's smoke, or if you're using them out in the garage for doing painting or car care, and you want to put a mask on, this will give you a really good seal underneath and around the nose, where people seem to have the most problems. So you don't have to wear straps behind your ears, you don't have to have the heavy headgear, you can just put it on and take it off and use it again. So in summary, choose the right silicone tool, choose the right silicone adhesive and the right tape for your application, to add to your capabilities and to expand that design tool chest. Select the right opportunities to use that tool. It doesn't work for everything. There are special areas that it excels in. And for those areas that nothing else has maybe worked right, or you haven't been able to even produce the thing that someone has an idea for, take a look at the new silicone adhesives. They're gentle, they give you secure adhesion, on compromised and sensitive skin types, as well as just adults who don't want to deal with skin stripping. And it gives you that low trauma removal, so you can use the tape again or use that same area again. And remember that handling and cleaning are important. They are silicone adhesives, and they require special treatment at converting. So thank you all for coming, and please feel free to stop by our booth. I'll be there the rest of the day. Thank you.